I just completed the video I did for the solar panel for my workshop area, and this is a video that I'm doing post that video just to bring you up to date as far as where I stand. It's going to be a while before I do another video, and the reason why is that I'm going to have some pending surgery, eye surgery scheduled to get you up to speed as far as what's going on. This is the last week of April 2021, and during that prior video where I was doing the solar panels, while I was editing, I noticed that I had a long tear coming out of my I have dry eyes anyway, so I've always been used to sort of wiping my eyes just because of the moisture accumulating in the corner of my eyes, but that one was kind of noticeable. So a few days later, when I was in the house, I got my eye drops, and this stuff is called Pataday, P-A-D-A-Y, and this stuff is better than the stuff you get usually you buy in Walgreens or CVS over the counter. This used to be a prescription eye drop, and then they made it an over-counter product, which works real well as far as irritations and dry eyes and things of that nature. So I put this in my eyes, and like typically when you do it, you kind of put it in one eye, you blink and close that eye, and then you go to the next eye. And when I was doing that, I noticed I'm nearsighted, so I wear glasses, but when I'm reading stuff like that, I don't need glasses, but I noticed that it was like a little blurriness to my left eye. And I was kind of blinking one eye to the other eye, trying to figure out what was going on. For near vision, my right eye was focusing properly, but then my left eye was, I first noticed it was blurred, and I thought that, well, maybe it's time I need some glasses or the prescription level of my eyes are changing. But then I noticed part of that, in addition to the blur, even when I put my glasses on, I couldn't really get a good focus out of the left eye. And I noticed that it was like a spot in the center of my vision. So like everywhere I moved and looked, I noticed that spot, couldn't get rid of it. And it's like you try to look around the corner of it, and that's not working because that's in the center of your eye. And what it looked like was, it looked like, I don't know, if you write something on a piece of paper and then you take it and pinch it, that's what it looks like. The words, you can put the alphabets A to Z on a line all the way across, but then you can take in the middle of that and just pinch it, you can't see it. And the problem with the focus of your eyes is that wherever you look, that pinch part follows it. So you can't look around it like you normally do. If you have something three-dimensional, you'll look around and try to get around that object to see it, but with your eye, because of the focal point of your eye, you don't. You can't do that. So I made an appointment to my ophthalmologist, who I usually go to once a year, but sometimes it might be 2 years. But I went to see him, and I was expecting him to say, well, my prescription level has changed in my left eye, or he'll subscribe me some drops and come back in a month and everything will be okay. But he went on to tell me that I had a condition called a macular hole. This illustration I stick in here is an example of a macular hole. This is at the back, the very back far end of your eye. And what that is the lower photographs show what the eye normally looks like, and then as you progress upward, it shows like a tear or break, and it turns into like a little mountain. And if you look at the next video, you'll see that a little drop, a little dip. That's what it normally looks like. That's what the back of your eye normally looks like. That small dip, and that's really the place where it actually provides all the focus of your vision. Now, the next photo following that, you'll see that kind of like two heels on each side pointing upward slightly. That's when you have a rupture of your macular, and that causes that focal point that was on the previous video to disappear. So now when you look at things look like they're kind of out of shape, out of focus, blurred, or they're spotty, like shown in these couple of videos, these couple of photographs. Here is what it looks like when you're looking at it. Now when you look out both eyes, you don't really notice it, but if you look out, in my case, my left eye is noticeable. But again, looking out both eyes, it looks fine. I mean, it is like something's off, but it's nothing. Which is, you're gonna have to look it up, because I don't want to get into explaining it. But if you're at the point now of this video and you're watching this and you have a macular hole or been diagnosed with a macular hole, you know exactly what I'm talking about. But what it is there's the focal point in the back of your eye that's pulling away from another membrane of your eye. I'm trying to explain it the best I can in layman's way. And because of that movement, it creates a tear, a circular tear, and that circular tear is part of the focal point of your eye, and you can't focus with that. So he said that I have this macular hole in my eye, and it would require a surgical procedure. You know, sometimes they diagnose this as, sometimes it's self-curing over time. Other times it requires surgery. So he referred me to a retina specialist, ophthalmologist, who I went to see a couple of days later, and he took some CT scans of my eyes and this and that, and his name, I won't give his real name, but his name was let's call him Dr. T. I was referred to by Dr. K, the ophthalmologist, to see Dr. T. Dr. T examined my eyes and he concurred that I did have a macular hole. Now he gave me a description as far as what this is and what you need to do about it. But I was thinking, well, now I got to worry about a surgery. And you have surgeries on other parts of your body, but your eye is kind of like, well, you only got two of those, and if you lose one, you got one eye. And that was the reason why, even though I had that little pinch in my left eye, it wasn't really to the point of irritation where I really just had to have something done about it, because when I open up both eyes, I can see distance and everything very well. It's just that when I close that bright eye and try to look, it's just hard to read anything. And I know because of this pandemic that we're in, the DMV here in my state have postponed updates to your license, and I'm scheduled, that extension ends June, so I'm fearing, well, I might not be able to see to pass the eye exam, so I gotta get something done. And also I can live with the one eye, and when I have both eyes open, it doesn't really bother me. It doesn't hurt at all, and it doesn't feel uncomfortable. It's fine. But then you're always thinking, well, if I lose, or if the same thing happens to the right eye, now I'm in trouble. I'm an SOL here, so I figured I better follow up and see. So Dr. B, ophthalmologist, a retina ophthalmologist, said I needed surgery to fix that procedure. And this bubble, you got to put your head, keep your head down like this for 7 days or 2 weeks. And sleep like that with your head down, and you know. But look it up if you want to see what all this is. But anyway, he said that more than likely after the macular surgery, you're going to develop cataracts. And he examined my eyes and said, I have a cataract in my left eye, but it's so small that normally under normal circumstances they wouldn't do anything about it because it's not bothering me. But he said that because of this macular surgery, more than likely there's a high percentage chance you're going to get cataracts, and it's better to do the cataract surgery before the macular surgery rather than do the macular surgery and then within a year you develop a cataract and then have to go back in for that cataract surgery. So he referred me to, you get this, they're passing me down the line here. He referred me to a cataract specialist, and quite naturally he said, well, I'm a candidate for, and he suggested also that I have the cataract surgery with a new lens put in before the macular surgery. So this is where I am today. Come tomorrow morning, I get up and go to a COVID testing facility. Oh yeah, by the way, I've already had my 2 COVID shots, so that's fine. But as far as any surgical procedures, you got to have a COVID test. So I got to get up tomorrow morning and go and get that test, which will be, tomorrow will be Monday. And then Tuesday night, I start taking my drops that I already got a prescription of. And then I'll go in for surgery Wednesday for the cataract removal and the new replacement lens. As you can see, this is starting to get long, so that's the reason I'm going to do this in multiple parts, and just to give you a record of my voyage. And what I was saying before when I switched cameras, my audio got reduced. But what I was saying, this is getting long, and I just wanted to cut this one video short because I'm going to do multi-number of videos as the time comes and the need comes. I'll generate a video to just give you a status of what's going on with me. Again, as I said, the surgery for the cataract is probably recovery, probably be the end of May, the 1st of June. Afterwards, I go and start getting prepped for the macular surgery, which is a longer recovery time. So I'm thinking that most of the summer my time is going to be occupied taken up with recovery, and it might be quicker than that, but I just don't want to be in my workshop around dust and sawdust and things and chance the possibility of getting debris in my eyes during the recovery. So I'm going to take a leave of absence and for the DIY around the house, and I'll be doing this in the interim.